Some countries provide healthcare to everyone. Others treat it like a product you buy. And both sides claim their system is the only realistic one. So today, let's strip away the slogans and ask two real questions. Should healthcare be free? And is it actually possible? First, let's clarify something. Healthcare is never truly free. Doctors still need salaries. Hospitals still need equipment. Medicines still cost money. When people say free healthcare, what they really mean is free at the point of use. Instead of paying when you're sick, you pay indirectly, through taxes or public funding. So the real debate isn't about whether healthcare costs money. It's about who pays, when they pay, and how fairly the cost is shared. Countries with universal healthcare don't rely on magic. They rely on structure. They usually have strong tax collection, centralized price negotiation for medicine, emphasis on prevention instead of emergency care. When everyone contributes, the risk is spread across the population. Healthy people support the sick today, knowing they'll be supported tomorrow. This model works best in countries with stable governance, lower corruption, and long-term planning. In other words, free healthcare is not impossible, but it requires discipline. So why doesn't it work everywhere? Because universal healthcare collapses when governments mismanage funds, corruption drains resources, population growth outpaces infrastructure, or politics turns healthcare into a weapon. In some countries, systems are underfunded, overcrowded, and slow. People then conclude, free healthcare doesn't work. But the truth is more uncomfortable. Bad management doesn't invalidate the concept, it exposes the execution. This is where philosophy enters the debate. If healthcare is a human right, then denying treatment based on money is morally wrong. But if healthcare is a service, then access depends on your ability to pay, like any other market product. Most societies already agree on one thing: police protection is not optional. Firefighters don't ask for your credit card. Courts are publicly funded. So the real question becomes, why is healthcare treated differently? When illness is not a choice. So, should healthcare be free? Morally, many argue yes. Practically, it depends on the system. Free healthcare is possible, but it requires honest governance, efficient spending, prevention-focused policy, and citizens willing to contribute. It's not about left or right. It's about whether a society sees healthcare as an investment or a luxury.